dealing with lives, and I think at the end of the day we all need to realize that we're dealing with lives, and so we absolutely can make an impact.
I have the opportunity to give a lot of funding away to nonprofit organizations across the state, and just seeing the work that they do around oral health issues inspires me every day.
It's our job, it's our obligation and opportunity at the same time to promote the oral health of Arizonans.
Could we do the work we're doing? Not as easily, and I don't know if I would be able to, because it's tough to do the work we do.
I don't think people realize at night you have children in the schools without shoes, and oral health care is part of that issue. I think oral health, or the lack of oral health, is really an issue of lack of funding, lack of resources. So when you see a child with just catastrophic dental disease, that's not their only issue. And I think the Muller Coalition helps bring in all those resources, all those stakeholders. We all know what it's like out there. And so we're all looking to solve those issues.
One child came up to me and showed me her tooth, and she said she said it's really causing me a lot of problems. And this was at a Girl Scout meeting, and just talking to her. She was only like 9 years old, and I asked her. I said, "Well, are you gonna have your mom or your dad take you to the dentist?" And she said, "Well, we really can't go to a local dentist. We have to go down to Mexico." And so once I heard that, that's what really prompted this whole program for the Children's Dental Health Awareness Program in the Heber-Overgaard area.
When we have a child in the chair, when we have a kid in the chair, I have two patients always. I always have the patient in the kid in the chair, and I have the mom. Or sometimes I have the sister. There's always more than one person that I deal with at any visit. And so we have to make sure that we know where all of them are coming from at that time.
When you go in there and you see the actual outcomes of these initiatives by these people who are providing the care, you finally start to see that there is true value to the money that we're putting at work. And it's very gratifying. I don't know how you could not go into an environment like that, look at people going in pain and suffering or in need, walking out with smiles on their face and not have an affected heart.
Now, Delta Dental, though, does want more than just give us money. Knowing that Delta Dental thinks enough of what we do and the work we do to even give us money amazes me. Every single year we get a grant.
And this is the way we do that, through our foundation.
Over the last few years, we've doubled the amount of funding that we give out on an annual basis. We've doubled the number of grantees, and we've broadened our reach geographically tremendously. So we have grantees across the state now, and I think watching that grant making evolve has definitely been the greatest accomplishment.
It makes me feel like we're really accomplishing something. I do think about the faces of the children that I screen, the ones that have urgent needs. Where are we going to send those kids at the end of the day? Those are the faces that I think about, and I think Delta Dental makes me feel a little better at night about what we're going to do to help.
By the end of the day, working with those families, hearing those stories, trying to make a child feel good and happy about coming to see us. When we drive home, we complain about nothing, and we thank God for what we have. Being able to do what I do reminds me of how blessed I am, and how blessed I am to have people like Sandi Perez and the people on the Delta Dental Foundation Committee. To have those people behind me doing what we do, they're like little angels to me. And my sister and I do not take that lightly. And we thank thank God every Saturday as we leave that clinic.